Hi, Dr. Pelto here. I want to go over today something called a plantar fasciitis scorecard. And the reason I put this together is because many times patients that they come into the office, they're really not sure when they should be seeing a podiatrist. And many times you could spend a lot of time and a lot of money and before you see a doctor, and you may need to see them sooner. So what you'll see here are some of the ways that you're going to score your pain if you have plantar fasciitis. And here are some numbers. And basically, the lower the number, the less severe the issue is. The higher the number, the more severe the issue is. And then you give yourself a score. And after we look at these, we're going to be looking at the score that you give yourself. And so you can evaluate basically when you should see someone and when you shouldn't. So let's first look here at the severity of symptoms. So basically, if you don't have any pain with your plantar fasciitis, you may have had pain in the past, and that would be 1, 2, or 3. If you have pain when you do extended periods of standing and walking, but besides that you don't have any pain daily, that's a little bit more. If you have pain daily when you're walking and standing, that is a 7, 8, or 9. And then if you have pain all the time when standing and walking despite all treatments, and it even hurts when you're sitting down, that's a 10, 11, or a 12. Okay, so severity of something is something that's very important with plantar fasciitis because the more severe it is, the further you get over here, the more likely it is you'll need to see someone. And the same thing with length of symptoms. If you've only had the symptoms a few days or up to a week, but then they've gone away, probably don't need to see someone. If you've had symptoms for a week to a month, a little bit more, maybe you should. And if you've had symptoms for 1 to 6 months, or between 1 and 2 years, or even more. So this category is where you should probably be seeing someone. If you had it once and it never happens again, probably don't need to see anyone. There's something called morning pain that happens with plantar fasciitis. It's when you get out of bed in the morning and it hurts. If you don't have any pain when you get out of bed in the morning, it may not be as severe. If you have occasional pain in your heel, but it goes away after a few minutes, it's less severe. But if you have pain every day, when you get up in the morning or after sitting and driving, this is a key. So when you get up in the morning, it hurts. You start walking, it goes away. Or if you sit in your car, or if you're sitting down at work for a period of time, and then it goes away, it's severe, but not as severe as this. These type of people here, they have pain every time that they get up, whether they're sitting, whether they're sleeping, and that pain does not go away. That's the key factor. It stays painful most of the time. Next, we're going to look at the effects on your lifestyle. My plantar fasciitis does not affect my lifestyle. I can do anything I want. You can keep very active. That's great. Probably not that bad of a problem. I only notice my pain in the heel when I'm walking for longer periods of time and exercising, but I can push through it. Okay, if you can push through it, it's less intense. If you have pain daily, but you can still work and do your daily activities, that's severe. Because if it's interfering with you daily, but you can still do work, but it's still interfering, you should probably get it checked out. And all I can think about is pain. Okay, my work is affected by it because of the constant pain, and I've stopped working out. Okay, sorry about that. I'm going to fix that little error there in that word. And then we're going to talk about weight gain and activity level. I have no weight gain and no change in my activity level with plantar fasciitis. Don't need to do much. I've gained a few pounds due to my heel pain. Not a big deal, but if you gain 5 or 10 pounds, it gets more severe. Your activity is greatly reduced. And then I can't do anything because of my heel pain. I've gained over 20 pounds since my symptoms began. That's something that is serious. Let's talk now about your understanding about plantar fasciitis. I'm interested in learning about my condition. I regularly see my doctor for treatment. That's important. I find that people that see their doctors and that get treatment, they tend to get better quicker. If you have a good grasp about what causes plantar fasciitis and you want to learn more, once again, learning is the key. If you've Googled the condition and talked to other people about plantar fasciitis, you have to be careful about that because if you talk about this with other people, some people, they get one cortisone injection and they're better. Others have to have treatment for years and years. And then if you're not interested in learning about the condition and if you think your doctor should be able to fix you or someone else should fix everything, that's not a good mindset to have. Okay? We'll talk now about effects on attitude. I have no problem and don't feel like my plantar fasciitis affects my attitude. That's easy. I've had a few bad days because of my heel, but I think it'll get better with time. And then it gets to be more severe when you get aggravated. You get aggravated with how long you've had the symptoms, despite trying to get better. And then even worse, it gets down into the depression. You get depressed because of how debilitating your plantar fasciitis is, and you're not sure what to do to make it better. Okay, this something you should see someone. You shouldn't just give it more time. And then lastly, we talk about shoe gear. I can go barefoot and wear my shoes that I want without any problems. That's no problem. I feel better with shoes that have more support. That's very common for most people with plantar fasciitis. And when I'm barefoot, I have pain, but as long as I have better shoes, I can be more active. And then here, I have pain with shoes and without shoes. There's nothing that is comfortable for me. So what I would like you to do is to pick your number on each of these and then score it. So basically, you write the number here on the right-hand side, and then you put the total score down here. You're going to find at the bottom of this video a PDF to this book where you can download the PDF and get this actual chart. So if you want to score yourself, because it's kind of hard to do it when you're watching the video unless you hit pause. But you can hit pause, and we're going to go to the next portion. So if your score is 0 to 24, you probably don't have a problem with plantar fasciitis at this time, but you may have had a problem in the past. In my opinion, you don't need any treatment, but would benefit from wearing supportive shoes as well, foam rolling on your own. I find that foam rolling is really effective, and you'll find that more in some of these other videos and the resources in that little plantar fasciitis book. If your score is 25 to 48, you have some mild symptoms of plantar fasciitis. You may be able to treat it on your own with some home therapy treatments. So the home therapy treatments I'll talk about in the book underneath. There are also some resources that you can look at on Amazon to get those. And if the pain becomes worse or bothersome, you should probably get help from a podiatrist to help this condition. 49 to 72, you have severe symptoms and are probably already getting treatment if you've had these severe symptoms or you're just living with it. If you're not, you're receiving treatment, you would benefit from treatment to help resolve your symptoms more quickly. This is something that I find a lot of people, they try a lot of treatments and they buy night splints, they buy new shoes, they do everything but seek out treatment. And in my opinion, it's just much quicker to seek out treatment. If you find that you've tried to buy 3 or 4 pairs of shoes, you bought a night splint, you've been stretching, you've been icing, you've done all these things, if you've watched over 10 YouTube videos on this, you should probably see someone about this condition. Okay, they can get it better quickly. And then you have very severe plantar fasciitis, 73 to 96. You need help urgently. You may have other conditions along with plantar fasciitis that you should seek help from a professional. Their help from a professional gets better quicker. I would recommend downloading the book underneath. It's called the Plantar Fasciitis book. There's a lot of good videos and content, and something that can help you to determine what treatment is best for you, because not all treatment is the same. Hope you've enjoyed this. Thank you.